Okay, hello everybody. We are group 2 and here's our presentation. I'm Gerald. I'm going to start it off. We also have Caesar, Sana, and Denise in our group. All right, the introduction is for our hypothetical situation is that we are a group of graduate students from FIU in the professional counseling program. And our mission is to assess the SMART program, which stands for Smart Minds and Resources Thinkers. According to their website, Miami Church Initiative, or MCI, the SMART program is built on the premise that a high quality early learning preschool experience gives children a much better chance to succeed and begin formal school eager and able to succeed. All right. On their website, the MCI says that they are a 501 nonprofit organization focused on breaking a cycle of poverty in Liberty City, a Miami neighborhood with a per capita income lower than 97% of the U.S. neighborhoods. And the website also says, in partnership with Liberty City's residents, youth, religious centers, schools, and businesses, a nonprofit organization, we seek to address the needs of the community by investing in our children. Miami's Children Initiative and its partners are making bold moves to transform the lives of children and families in our communities by providing a unified system of support, education, and care that begins from birth through college and career. MCI believes that Liberty City's strength lies in the underdeveloped potential of its youth, and that through focused strategic work, the potential of each child can be unleashed. And as is there in the statement, this evaluation would be used with a transformative paradigm. Okay, the members that are a part of the SMART program are the children of Liberty City, 0 through 8. As the project grew, it expanded to youth up to 18 years old. Currently, there is no data published about how many members are actively enrolled in the program, but it is available to all learning centers, school-based programs, childcare homes, and K-8 centers. And you can sign up on the website, and they have a wide range of activities and summer camps and holiday gatherings. Okay, the stakeholders of this program, the main stakeholder, is going to be MCI because they fund the program. Secondary stakeholders they're all listed there. I won't read them all. MCI Early Childhood Educational Team, Parent Involved Specialist, Model Teacher Curriculum, Liaison Coordinators, DCF Licensing Positions, Quality Counts, and 2 MDC Educational Transformation Office.
Type of the program evaluation. The type of the evaluation plan developed is summative evaluation, as its purpose was to evaluate the program's initiatives and to render a summary judgment on the program's performance. The finding of this summative evaluation is intended for decision makers to gain knowledge of the program's performance and in its respective goals in order to make plans for this program, for the SMART program. And some of the example would be, the result will be used to plan accordingly for allocation of fundings and resources, organizing, leading processes, or restructuring policy and procedure. Next. Okay, Sharp Minds and Resourceful Thinkers SMART system of education focuses on building capacity through leadership development and quality counts in the early learning centers that feeder pattern into the Charles R. Drew K-8 Center for the Modern Arts, ensuring that the program pre-K students transition into kindergarten ready to learn with a strong nurturing support system, engaging parents in their children's educational experience and progress, keeping children engaged in the ongoing educational processes through structured after school and out of school activities, along with summer learning. So these are the goals of the program.
All right, so for our first goal, Sana just explained, the SMART program first goal aims to build capacity through leadership development and quality counts in the early learning centers, which then follow a feeder pattern into the Charles R. Drew K-8 Center for the Modern Arts. Leadership, as discussed on previous slides, includes the various figures at MCI's Early Childhood Impact Team and MCI's Early Childhood Educational Team. For us to evaluate leadership development, we aim to obtain records of current and previous employees. We also will be evaluating the qualifications of current leadership positions within both teams and considering job opportunities slash growth within the SMART program over a period of about at least 2 years. We will also take note of promotions as well as outsourcing within the program. To properly assess if students enrolled in early centers have been following this feeder pattern into the Charles R. Drew K-8 Center, we will plot at least, again, the last 2 years of students who were enrolled in the Early Learning Center and the percentages of students who have now enrolled into the K-8 Center.
All right. And so for the SMART Goal 2 analysis, in the second goal of SMART, as Sana said, ensuring our pre-K students transition into kindergarten ready to learn and with a strong nurturing support system. This goal is going to be measured by using the outcome indicator. So one way that we're going to do it is by comparing the academic scores of children enrolled in the SMART program at Charles Drew to other K through 8 schools in higher income areas. We will reach out to the Miami-Dade County Public Schools Education Transformation Office for academic scores of the schools that are identified and comparable to Charles Drew. We also are going to be determining if children from pre-K to kindergarten are reaching their normative milestones that are needed to succeed in kindergarten. A random selection of participants will be selected and developmentally assess their skills and deficits to the identified. They will be compared to the school that's chosen for comparison. This specific task can be time consuming due to the collection of data and hiring experts to conduct these assignments. Also, we will be identifying barriers in the environment that can negatively affect the successful transition of the children, such as a dysfunctional family environment at the child's home.
So SMART Goal 3. Goal 3 is regarding evaluating the parents' engagement in the program and their children's educational experience. So in order to know the community and parents' reality and the situation of the student's environment, the evaluator needs to have an interactive link with the parents, and the transformative epistemological assumption holds that knowledge is socially and historically located within the complex cultural context. Therefore, a trusting, culturally respectful relationship must be developed between the evaluator and the parents. This brings to the surface issues of effective communication and mannerism, which needs to be leveled with the culture and background of the parents in order to proceed efficiently with other steps of the evaluation and develop them with a collaborative plan. To engage parents in the evaluation, they should be invited to participate in workshops and meetings held with the goal of providing information about the project and raising the awareness of relevant issues. And also, they can be invited for group discussion and focus groups about the relevant issues. Next, please. Okay. Now, the strategies and variables for this program evaluations are the relevance and benefits of tools and practices used for parents' involvement, the extent of parents' engagement and involvement with the program, the varying perspective on parental engagement and the program and children's experience, the amount of information shared and collaboration with the parents in the program's procedures and plans, and lastly, the progress the parental involvement made towards the program's outcome and students' performance. And all of these factors should be evaluated to identify the current situation of the parents' involvement with the SMART program in order to find the issues, any loopholes, or identify any opportunities for advancement and improvement of collaboration and partnership with the parents and increase parental engagement in the SMART program. All right. So the variables that we explain can be measured based on a process indicator, which measures the program's activities and outputs that are a direct product of the activities. This method would allow us to indicate whether the program is being implemented as expected, does it have any issues, and to identify the whole performance of the program. To evaluate the activities, the following data should be analyzed. Prior invitation process, such as emails and letters that they send to the parents, they should be reviewed. And the parents' meeting location should also be observed to see how the condition is. Information shared with the parents in prior meetings should be reviewed for the relevancy and details. Aspects, activities, and perspectives on parental engagement in the program should also be assessed to see what are the type of their involvement. Communication skills of the presenter should also be assessed through utilizing the criteria basic skills test or test of oral communication skills to make sure that the presenter have the ability to present information well. To evaluate the outputs or products, the parents should be invited for a meeting regarding parents' involvement, and following factors should be analyzed and data should be gathered. The number of the parents who show up for the meeting versus the total of the parents, they should be analyzed, and the parents will be interviewed for their information of the program and involvement with the children's performance. A parent survey should be conducted on parental strategies for involvement in children's performance and their parenting style, as well as knowledge and expectations of the program, just to see like how the parent is handling the situation at home, and also to see what they expect from the program, to how they want to be involved in the program. Prior documentation on children's performance should be evaluated and matched with their parents' involvement. All right, now for the analysis, the evaluators would use qualitative methodology for analysis of data. The program's historical artifacts and prior parental involvement documentation would be reviewed and analyzed for their efficiency and applicability. Focus groups with the parents would be conducted to gather information on the strategies and involvements, and it would be and all of these meetings would be recorded. Parents may participate in the evaluation at their convenience location. They can either participate in the MCI building, school, or even parents' house when like it counts as an option of the choice. Survey data will be collected utilizing the Qualtrics system, and the surveys can be completed at home or MCI building, where they provide the electronic tools and everything. So based on the parents' choice and convenience. Data for multiple choice questions on the survey can be analyzed electronically, but the manual part should be analyzed different than so the recorded interview and quotes and written statements in the survey can be coded using selective coding based on the core categories of variables, and then analyze and interpret it for their themes and variety, advancement, and so on.
Okay, the fourth goal of the SMART program is keeping children engaged in the ongoing educational process through structured after school and out of school activities, along with summer learning. Accounting for the children's perspective implies translating the variables in terms that are culturally sensitive and age appropriate. For the purpose of evaluating this goal, process indicators, outcome indicators, and impact indicators will be measured, contemplating different variables that assess engagement, such as audience, retention, activity, sentiment, and growth over time. There is a combination of qualitative and quantitative data collection and analysis. The integration of the outcome of these variables will determine the effectivity of the goal. The measure of the process of the structured activities that keep children engaged in the after school, out of school, and summer learning process, uh, looking at the process indicators. First is audience, which would be comparing the rate of children that are signed up for the smart educational system with the rate of children that actually attend the event. This data is available to the program for which it doesn't need to be collected. This makes it time and cost effective. And we'll be trying to answer the question, what percentage attends to the extracurricular activities? A higher rate of attendance will indicate higher engagement. The other variable that we'll be looking at is retention, which is measuring the time children actively participate in the specific activities. So we'll try to answer the question, how long can children stay and participate in the activities? We will measure variables in engagement with activities such as homework, recreational, musical, or other structured activities sponsored by the SMART program by measuring the percentage of participation across time. This will also include what percentage of the attendees stay after 30 minutes, 1 hour, until the end of the day of the activity, depending on the length of it. For example, if the activity is designated to last 1 hour, what percentage stays the whole event, the time of the event, or if they leave it within 10 minutes, 15 minutes, that is also going to tell us the level of engagement. The measure of the effects of changes of the structured activities across time from an outcome indicator perspective. Sentiment. So we're going to measure the emotional experience of participants, the children, as a predictor of further engagement in future events. The measure can be done to activities with different classifications, such as artistic, sports, educational, etc. It should answer to the question, how do children feel about the activities? It can be done by asking children to rate their experience in the extracurricular activities using the smiley face Likert scale. Children can vote their emotional reaction to the event by marking the emoji they identify with at the end of the activity. If we have a large number of responses indicating happy or excited, we could conclude that the level of engagement is in a positive direction. In the opposite, if it shows awful or not happy, obviously some changes need to be made. The measure of the effect or changes of the structured activities across time from the impact indicator. So we'll be also evaluating growth, and that is monitoring the metrics to track new members. So we want to answer the question, how many new members join each week? How many members leave? Is there an overall trend of increasing or declining? This data should be available at Miami Children's Initiative. A statistical analysis will reveal a growth curve from the moment the program started until present. This measure has predictability value for future membership growth.
Some ethical concerns that we must take into consideration regard, we believe, student privacy under current FERPA regulations, as well as ensuring that we are protecting private information from this data that we are collecting throughout our research. We also want to make sure that any questionnaires or meetings done with faculty, children, or parents are necessary and that they are pre-approved by relevant entities. Issues concerning discrimination, abuse, power imbalances, and their repression will be dutifully noted and addressed to MCI. As researchers, we need to ensure that we are also following the American Psychiatric Association's ethical guidelines. This includes paying particular attention to areas concerning research and publication, human relations, privacy and confidentiality, as well as record keeping. Before starting any kind of research, we will discuss our plans with the Miami Children's Initiative and the SMART program faculty and staff to ensure that we are proceeding in a way that does not potentially harm or put at risk the information of privacy of those involved. If issues are raised at any point throughout our study, we will work to find an alternative solution without undermining the total scope of our research.
This project is intended to evaluate the scope of research, the scope of reach of the Miami Children Initiative Smart Educational Program in terms of its effectiveness in acquiring their projected goals, the ones that we listed initially. Following the transformative paradigm that focuses on engaging all stakeholders, especially those who have traditionally been excluded from evaluations and from decisions associated with evaluation studies, this evaluation encompasses the input of all parties involved in the project, that is, children, parents, community actors, and implementers. Multiple resources and continued efforts from local residents, youth, schools, businesses, religion centers, and other nonprofit organizations have been invested with the aim of developing a prosperous community. The results of this evaluation belongs to the community, who has the power of whether to continue supporting the project, improving on weak areas, or producing drastic changes. The results will facilitate the pathway of action and the decision-making process. They should be presented in a parsimonious way using visuals such as pictures, graphs, presented in simple terms as to reach to the understanding of everyone in the community. Answering the questions: are the intended goals met? Why? What should we change? What should we strengthen? How will the changes should be implemented? Who is to implement the changes, and what resources are needed? Results should also be in such a way that is culturally respectful, that follows the norms and values of the community. Further details such as statistical data and analysis may be available as well for those who wish to do a profound analysis for further research, as well as for modeling of similar evaluations.
For implementation, we want to do, after collecting the data and presenting the results to MCI's board of directors, we also want to discuss areas that are of critical importance and what solutions are available or recommended by us. Our research will, at the discretion of MCI, be used towards furthering the initial goals and values of the SMART program. We can also offer to present the results of our research either in full or in summary to the SMART team if MCI would deem it to be beneficial. Our hope is that our research can be used in bringing about the most positive change towards the SMART program. This would allow it to be in a more effective tool towards further solidifying the initial goals of the SMART program. As clinicians, we can also suggest or conduct employee training at the discretion of MCI, as well as offer in-house guidance. So we can actually go to the schools, or we can go to the SMART program itself on how to improve and make sure that there is a safe and equal environment for the students, as well as staff and other employees. Our suggestions will also keep in mind the financial and legal implications of the SMART program, as well as MCI's donations. These are our references. We would like to thank you for joining us on our presentation on behalf of Group 2 for our analysis of the SMART program at MCI.